Okay, so sometimes our immune system isn't working properly. So we're going to talk about the pathophysiology next of an altered self-defense and what happens then. One of the most common things we see is hypersensitivities. You probably have heard these called things like allergies before, right? There's different types of hypersensitivity reactions, right? A hypersensitivity reaction can be things like allergies, an autoimmune disorder, or an alloimmunity problem, right? They can also have a range of severity. So some of us, probably a lot of us, suffer from things like seasonal allergies, or we sneeze if we get into dust or things like that. I mean, some people act so much more severely to their allergens and have problems like anaphylaxis, where their throat swells shut, to things like peanuts, right? Anytime we have a hypersensitivity disorder, the thing to remember is that you have to have been exposed to the antigen first, right? So you had to have gotten contact with it somehow, and then the next time is whenever you get the sensitization to it, right, where you will have the reaction. Right, there's different types of hypersensitivity reactions. Right, so let's talk about them. There is type 1, which is an IgE mediated response. Right, IgE because that's the antibody. That's the name of the antibody that's involved. What it does is it stimulates the mast cell. The mast cells are the ones in our body that release things like histamine and cause your allergic kind of common allergy symptoms like runny nose, stuff like that. They also cause problems like inflammation, right, and trigger the inflammatory response. So examples of an IgE mediated or type 1 hypersensitivity are like your seasonal allergies or asthma. There is also type 2, which is known as tissue specific. Alright, so for this one, our antibodies affect our macrophages. Alright, and then our macrophages are going to attack specific tissues within our body to cause a disorder. Alright, so for instance, when they attack our thyroid, we have a disorder like Graves' disease, where people get a hyperstimulated thyroid. Right? If they attack a different part of the body or a different specific tissue, right, then you're going to have different symptoms, right? So for instance, some people have irritable bowel syndrome, right? That has been related to a hypersensitivity disorder of the intestinal tissue, right? So instead of the thyroid being impacted, for those individuals, the tissue specific is intestinal, right? The other one here is anemia, right? There's a condition where a tissue specific happens to be the blood cells, and then you end up with anemia. Type 3 is immune complex mediated. Right, these cause more of a systemic reaction. Right, they stimulate the IgG and IgM as well, but instead they affect the neutrophils, and the neutrophils then cause systemic inflammation and reactions. This is correlated with disorders like lupus. There's also cell-mediated reaction, which is type 4. Right, there's no antibodies involved, because what happens is you have to have cell-to-cell contact between the irritant or the mechanism, all right, and the cells of the person infected or impacted. All right, so they have to actually touch it. All right, this is things like contact dermatitis or poison ivy, poison oak, things that give you rashes, stuff like that. You have to actually touch, for instance, the poison ivy to get the rash. All right, if you don't touch it, you just look at it, you're not going to get it, right? So that's why you have to have a cell-to-cell contact or cell-mediated. Right. Now there's different types of immunity, and we talked about it a little bit in the last section, just briefly. All right, there's innate, right? That's our natural, that's our non-specific immediate reaction to something wrong in our body. And we have adaptive, all right? This is our specific immunity. This is where we're actually using our immune-specific antibodies to respond to a disease, all right? And it's going to be specialized, all right? So with innate, it's just whether you should be there or not, all right? It's not antigen-specific. It just says, are you my cell of my body, or are you not, right? If you're not, then I'm going to attack you. If you are, then I will let you go, all right? It's an immediate response, all right? It's not antigen specific, all right? It acts independently of them, all right? And it doesn't have a long-term immune memory, all right, meaning that if you came in contact with it again, your body would act like it never saw it before, all right. Adaptive, on the other hand, all right, you actually respond, your antigens specifically respond to a specific marker, all right. So your antibodies are going to recognize the antigen. It's dependent on which antigen gets picked up, right, and then it mounts the immune response to create more antibodies to attack it, all right. So it is specific. So for instance, your antibody that for a cold virus is not going to attack a herpes virus, right? It's only going to specifically attack that antigen. Right, there is a lag time between when someone's exposed, right, to the full mounted immune response, and that's because we often need to make cells and get cells there and have a long-term immune reaction, right? But it does give you immunological memory, which means that once you're got it and recovered, or you have antibodies and you shouldn't get sick from it again. All right, now there's also passive versus active immunity. All right, so what this means is that does somebody actively fight the disease, or do they get immunity from getting antibodies handed off to them? All right, so adaptive immunity is after your body has been exposed to an antigen, all right, and has gotten better. All right, so in other words, your body actively fought whatever the organism was that made you sick. All right, so it's active immunity. You can also get immunity through passive protection. All right, so things where you have cells passed to you, all right, you didn't do anything to get better, you just get the cells that had the antibodies in them to help you recover from being sick. All right, so let's look at each of these two. All right, so passive versus active. All right, so passive, it's when we're taking it from one source and giving it to another. Most common example of passive immunity is mom to baby. All right, so moms can pass their antibodies to the baby in breast milk, in utero, which means, well, the baby's still a fetus and in the mother's uterus. All right, mom, her IgG, which is specific antibodies, right, will cross the placenta and protect the baby for the first few months. Those cells, when they wear out, will die off. The baby doesn't have long-term immunity because of them, right? We can also give immunoglobulin transfusions. Now, this is pretty rare, but if somebody has a specific disorder, we can give them a transfusion of just immunoglobulin, which contains specific antibodies to that, all right? It's whatever way they get the passive immunity cells, breastfeeding, in utero, whatever, the transfusion, it's short term. It's not going to last them a long time, all right? It's just to get them through a hump, all right? This is why we say babies should breastfeed as long as possible, because it helps. And then active immunity means that your body is going to actively respond to the infection or to the antigens, all right, create more antibodies and have a long-term memory, all right? So immunizations may be artificial, all right, meaning that they're man-made, all right, but your body actively changes because you got it to give you long-term immunity, all right? You have to have actually had the disease or been exposed to it, like with a vaccine, in order to have active immunity. Once you have, all right, it's long-lasting, all right, it's going to take a couple of days or weeks from the time of the exposure for the immune system to respond and to work, but it will be there and it will help, all right? Once you get reinfected, all right, you will actually react much quicker in about just in a couple of hours after exposure, all right? So there's also some more specific situations that can happen. So for instance, mom to infant, all right, that's an example of passive. The mom has her antibodies, her IgG antibodies that cross the placenta, all right. There are other antibodies that they've actually found in cord blood. So after babies have been delivered, they'll take a sample of cord blood and they've seen that there's other antibodies in there. So we know that the mom is handing things over to the baby to help them. Right, the elderly, as we get older, all right, they have a declining ability to respond to stress. Their immune system gets weaker over time. Right? Not entirely sure what from. We think because as you get older, the thymus gland atrophies, and that's what stimulates our T cell function and production. Right? Our lymphocytes, our white blood cells don't work as well. Right? But because of this, our elderly populations are at higher risk of autoimmune disorders, getting infections, and having things like cancer. HIV is one that comes to mind whenever people talk about the immune system and diseases. So you probably are well aware that HIV stands for human immunodeficiency virus, right? If it's not taken care of, all right, and eventually as the disease progresses as well, it will develop into AIDS, acquired immune deficiency syndrome, right? So according to the CDC, the body fluids that have the highest concentrations of viruses in them, right, are blood, semen, vaginal fluid, breast milk, and any other body fluid that gets blood in it, right? They've also found smaller amounts of the viruses in infected patients in the spinal fluid, in the fluid around the brain, or CSF, right? In the fluid in your joints, right, and as also in the fluid in or surrounding the unborn baby, or the amniotic fluid. It's primarily spread by unprotected sex, from an infected person to a non-infected person. Alright, some types of sex are riskier than others. Alright, unprotected oral sex is a risk, but not as much as unprotected anal and vaginal sex. You can also get it from sharing infected drug paraphernalia, and babies can have it if they're born to an infected mother. Alright, so HIV can be spread to a baby during pregnancy, the birthing process, and also during breastfeeding. Right. What happens is that the virus that causes HIV has to get into a living cell in order to replicate, right? That virus is then going to bind to those CD4 helper T cells, alright, and then they invade the cells. Once the virus invades the CD4 nucleus, then it is going to damage them, right? It uses an enzyme to splice into the cell's genetic structure, right, and then it is going to reprogram that cell. Right. HIV causes immune destruction because it destroys those helper T cells, or CD4 cells. Right, and we actually measure how people are doing in their HIV therapies by measuring their CD4 count. Right, HIV will destroy about 1 billion CD4 cells every day, all right, unless we can slow it down with medications and therapies. All right, the immune system, we start to see a reaction, all right, when their CD4 count drops below 500, right? Your normal T cell count should be between 8 and 1200 cells per milliliter, okay? Oops, sorry, I skipped ahead there. All right, if you don't have enough healthy T cells, specifically when we start dropping below 500, then we don't have a normal immune response to things, and we start to see complications. All right, people during their infective phase, all right, their initial infection, all right, is whenever the virus gets into the bloodstream and starts to rapidly replicate. That's called viremia, where we have a large amount of the virus in the blood. Oftentimes they have very few clinical symptoms. The virus is getting in there, it's invading, it's destroying cells, but we don't really see anything. It's very sneaky, all right. The viral load will steadily climb, all right, and it can do that for a number of years before people become symptomatic, right? Once the CD4 count gets too low and we have more symptoms and problems, then it's going to convert their diagnosis over to AIDS, right? The CD4 count is our indicator, our marker for the immune system and its function, so how well the immune system is happening and working. The viral count tells us how the disease is progressing, right? People with HIV and AIDS, the problem is that they're very prone to those opportunistic infections and cancer because they don't have an immune response. Right, so next we'll pick up with AIDS and how things change once their diagnosis converts.